Hi, my name is Gundeep Singh, and my topic was brain-computer interfaces, or BCIs. The bioethical question that I chose to examine was, should BCIs be a strongly recommended form of treatment for people who suffer from neuromuscular diseases? This is a significant issue because almost 6 million people suffer through some form of neuromuscular diseases, and BCIs provide a clear and positive solution for this problem. However, BCIs also have some interesting ethical issues that are associated with them, and thus they provide a great ethical debate. Some important vocabulary to note is BCIs and BMIs. A BCI is the same thing as a BMI, however a BMI is just named differently, a brain-machine interface. They both use a hardware and software component to enable communication between the brain and a computer. Invasive and external are the two main types of BCIs. Invasive is an implant that requires surgery, and external is a cap-like device that is put on the user's head. A neuromuscular disease is a disorder that affects the nerves that control your voluntary muscles. And complete locked-in syndrome is a neuromuscular disease in which the patient is under complete paralysis. However, I will refer to complete locked-in syndrome as CLIS. Now that we have examined some of the vocabulary for BCIs, let us look at some of the ethical harms. Privacy is one of them. Many people see privacy as a key right that is upheld by the Constitution. However, according to the Journal of Neurological Physical Therapy, BCIs do not uphold this right. This is because a third party must be required in order to ensure that the BCI is working properly. As a result, this third party can see levels of stress, hormonal levels, and mental health vulnerability of the specific person who is wearing the BCI. Another ethical issue is the psychological harms. In 2014, Glannon writes in Frontier that the failure of using a BCI is deeply harmful to the user's mental health. This is deeply troubling because, according to the Neurology Journal, the success rate of BCIs with CLIS patients is really low. Now that we have seen some of the ethical harms, let's look at some of the benefits. One of these benefits is prosthetic control. BCIs enable a user to gain control over a robotic arm. A set of studies from the University of Pittsburgh used a monkey to control a BCI, which enabled that monkey to control a robotic arm with a great deal of success. This has enormous levels of application for those who wish to regain their motor skills but are going through paralysis. Another clear benefit is communication. BCI can also enable communication for people who are going through paralysis, and they can do this without the need for going through a rehabilitation process. This allows patients to answer yes and no questions just by imagining a cursor moving to the corresponding side of yes and no. Overall, a BCI is very positive, and it has some clear positive benefits that can be applicable in the near future. However, as of today, we should not strongly recommend the use of BCIs for the treatment of neuromuscular diseases, and this is because of two main reasons. The first reason is because they are extremely harmful on an ethical basis. The privacy and the psychological harms completely outweigh the potential for having a communication as well as prosthetic limbs. However, this does not completely outweigh the possibility of those happening, and for those reasons, a BCI is a completely possible and possibly one of the most important ways of solving the problem of neuromuscular diseases. The next 10 seconds will be used to show the works reference slide.